Welcome to America's Heroes Group.
And welcome back. It's America's Heroes Group Roundtable, this time with Partner Community Healthcare Outreach with Dr. DeLon Canterbury. Today is Saturday, October 2nd, 2021. October is National Breast Cancer and Domestic Violence Awareness Month. I'm Sean Claiborne, National Guard veteran, Army Illinois National Guard. The host is Cliff Kelly. Executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. Today we have a panelist. Once you get to know him, I think you're going to get some good information from him. He has a lot to talk about. Is Dr. DeLon Canterbury of PharmD, board-certified geriatric pharmacist and president and CEO of GeriatRX Incorporated. GeriatRX Incorporated. He's going to talk about the power of deprescribing. Are you there, Mr. Canterbury?
Hey, I'm here. Hope you're doing well.
Pretty well, pretty good. So last year, Americans spent $539 billion on medications and prescription drugs, 80% of which are brand name. Okay, so tell us about deprescribing and what that is, and what is your mission, and what do you want us to know about what's going on?
Oh, for sure. So, thank you for the warm intro, for having me. Of course, again, I am a trained geriatric pharmacist, and something I tend to find in my senior patients are those suffering from unnecessary side effects, people that are taking medications that they no longer really need. And we tend to forget that there is a timeline when you start a prescription, and when you should stop needs to be addressed, if not quarterly, with your doctor. And so I started GeriatrX as a medication consulting company where we help families safely get off of harmful medications that can honestly put them right back in the hospital. So that's the power of deprescribing. It's a way of slowly and sometimes quickly using evidence-based science to wean people off of meds that are no longer really appropriate. And it's unfortunately a huge problem since we have overprescribing fairly rampant in this country today.
Why do we have overprescribing in this country? What is causing the push for medicine? So people will say, "Oh, it's because people want to make money and blah blah blah." What in your eyes? What's the real reason? Break it down beyond just the generic answer.
Yeah, there are multiple reasons, to be honest with you, and it doesn't quite always fall on the provider. We in our country, we like things fast. We like things now. We want to get answers quickly, and so providers are put in a rock and a hard place where they're balancing customer service and what's best for the patient. And so sometimes when you go in and you're feeling moody, you kind of want a quick answer, right? You want a quick solution. And so prescribing is generally the solution. However, we don't do enough of a good job in our healthcare system looking for preventative measures, looking for lifestyle changes, looking for ways to address diet, exercise, and other things people can do to, honestly, not need a pill. But that's the problem. We don't want to put the work in as patients sometimes as well. And so when you go into an office, there's an urgent state of, "Hey, doc, I need something. What can you do?" And so there are doctors who believe in the beauty of preventative health, but they don't want to get dinged because, that doctor didn't care for me. He didn't care about what I had to say. And so he just told me to meditate and woosah. And that can be, annoying for a patient. And so they're in a rock and a hard place. Not to mention, even though, there is sometimes, a monetary incentive for people to just prescribe something, the truth of the matter is our healthcare system's broken, and doctors are overloaded with many tasks behind the scenes. And so to take the time and actually start talking about what can we do to get you off of things, there are differences in specialties, there are differences in priorities. So there are just really multiple layers of barriers to deprescribing that we see today.
So it sounds like really it's more like the path of least resistance, more so than, okay, I'm making a quick buck here. I'm going to prescribe this medication, which is a general thought most people have is, it's a huge multi-billion-dollar pharma industry out there that's trying to just push pills to the public. But a lot of it falls on our shoulders because we're not doing the things we should be doing, or maybe being receptive to doing the things we should be doing when a doctor might say, hey, maybe we should cut out, eating Harold's chicken or whatever and go back to eating more greens and, and
Right.
vegetables and stuff like that. So that being said, first question before I get into this other part, but first question is, what are the main health issues that people see? My guess is that you see a lot of medications pertaining to cardiovascular health and the heart and things like that. Is that one of the main areas where you see a lot of pills being prescribed for things like that, of those kinds?
I mean, to be honest, it's everything. So that's something that we kind of underestimate is there are certain conditions that will make you more likely to be on a bunch of meds, right? So like kidney failure, diabetes, having high cholesterol or heart attack, stroke, stuff like that. They're going to put you on some certain things to keep you in line. But honestly, the problem is it's multifold. That's the thing. When you're older, you tend to have more than one chronic issue, right? You're going to have maybe 2 or 3 on average. And so depending on what combination you get, that can really dictate how many pills you're probably going to be likely to have on average, especially when we're talking about kidney disease and heart failure, like you mentioned. But it could be as simple as, you having pain. And so you've been on chronic opioids for 20 years since your back was thrown out at your job, and you're finding that your pills work less and less as time goes on. And that can still put you in a situation where you may have problems with insomnia, and you take another medication for insomnia. And so there are meds with a combo between insomnia and the pains, and that's, mind you, just 2 conditions. You can have a 4-fold risk of overdosing and potentially having a respiratory failure, because a combo of certain sleep meds and painkillers can cause people to overdose. So that's the harm that really we have to use more of our pharmacists to assess, because it could be as simple as an ankle sprain. Or, I even had a patient who had chronic pain after a hip surgery and had, a heart attack. And so she took aspirin for her hip injury, and she took aspirin for her heart. And we didn't realize, at least the medical team didn't realize while she was inpatient what was wrong. They finally found out that she was basically on dialysis because she had too much aspirin.
Wow.
She had too much aspirin. So she almost died during COVID, literally because of taking aspirin over the counter and aspirin for her heart.
Wow.
Aspirin like BC Goodies powder or whatever. So again, it could be just one thing. And that's the problem is the word that really comes up a lot is what's called polypharmacy. And it is basically the practice of using sometimes different prescribers who write different scripts and they don't quite talk to each other. The different doctors don't tell each other what they're writing. And then sometimes there are patients who use things over the counter or herbal supplements, and they combine them with meds, and there isn't anyone doing a full check because the system is just so leaky. It's just so fragmented. So polypharmacy especially can contribute to people being over-medicated. And it could be people using different pharmacies, different doctors. But the point is people who are taking more than 5 medications on average have a high risk of having drug interactions and a high risk of having adverse side effects.
So 5 is a magic number. If you're taking more than 5 medications, you need to be careful and talk to your doctor. But then on top of that, shouldn't doctors also be asking you, hey, what medications are you on? So that way, or do you take any over-the-counter medications? So that way they know up front if they have a risk of overprescribing.
Again, that's in an ideal world. And, for the same reasons I mentioned earlier, they barely have time to meet all their checklists in that 20-minute meeting with you and the doc, where you've already waited an hour in the lobby before you see them. You got a medical assistant who comes in and says, are you taking this? And they usually just ask one question, right? It's just like, are you taking these still? Yeah, nothing's changed. Okay, cool. And that's it. That's your med review. And that's the problem, is that we just don't incorporate pharmacists into that setting where someone's just having a thorough conversation. It needs to be a 30-minute to an hour-long conversation to go through all those meds. And so only a few doctors I know specifically assign visits just to look at the medications. It's generally lower on the problem list. They usually got other issues. The patient got stuff going on. There's a new thing here. And so a doctor has to choose what's important now. And sometimes it's very difficult, again, for them to take that time to really assess the meds. But this is where pharmacists are taking the charge. And it's exactly why I started Geriatrics, which is to not only support those doctors, but to support the patients. So they now have more trust in what they're taking and actually get better outcomes.
Do we have a shortage of doctors? Should there be more doctors? I remember when I was in college, one of a pre-med student told me there's like so many seats in med school every year. It's not like you can go like mechanics or being even an attorney. You can have there's no limit to how many attorneys you can have in any given graduation year. But there's only so many seats. So many doctors are going to be given a chance to become a doctor, are going to graduate that exam and be certified as a doctor every year. Do we have a shortage of doctors now?
You know, it's even worse than you think. It's not even just a shortage of doctors, but we don't even have enough people that are geriatric trained. We don't even have enough people to take care of people that will be on Medicare in the next few years. So we are grossly outgrowing the population of people on Medicare with an ongoing shortage of doctors. If you had a shortage of doctors back in your time when you talked to your friend, it's still going on, man. And then we haven't even talked about, equity and minority doctors. We haven't talked about health disparities as well. So we're having less and less. But we are seeing some growth in, Black doctors and Latino doctors. But overall, as a whole, there is a shortage. And so we have to start taking away ways now, because this is just right around the corner. I mean, Medicare is doing what it can, but it can't solve all the problems. And you'll be surprised how many people on Medicare still can't afford some of those copays and deductibles. So we got to change the system. And this is something that we're doing with our focus on value-based care, deprescribing, and healthcare cost savings with geriatrics and my expertise as a pharmacist.
And the thing is, also on top of what you just said, we also have an aging population. So the fastest growing population in the United States is seniors. So as we get more and more seniors that are living longer on top of that, that just makes the problem even worse. So I would say if one of the things that's not being talked about, climate change is a big issue. Nuclear war is a concern, but not as much. A bigger concern than nuclear war is an aging population and less medical assistance for people that are getting older.
Right.
Because is there going to be enough doctors when I become a senior? So I mean that's a serious question, and I'm concerned about that. I mean, I take what you said to heart, because in 2013, believe it or not, I almost died from overdose on prescription drugs. I was taking too many heart medications, and then I was actually losing weight and taking heart medication, and my blood pressure dropped to something like 40/20.
Oh, my God.
I was about to check out. So what you're saying makes a lot of sense, but then once again, if nobody's monitoring your progress and I was trying to do the right thing. I started drinking the fruit smoothies every day, and the weight to start pouring off, and I was still taking my medication every day like I was supposed to. It almost got me into a casket. So what does a person taking medication need to do to realize, hey, maybe I'm taking this too long? What are the warning signs that they need to know about, so they can actually, bring this up to their doctor? Doctor says you need to take this for 16 weeks, but maybe the number is 8 weeks. How can they tell?
Sure. Now, again, my philosophy isn't quite to stop all medications. I don't want to put people in harm's way, but it starts with an open conversation. And what I see a lot, especially in my senior populations, is that they kind of don't want to rock the boat. They're just kind of like, well, the doctor said it's good, so I'm just going to be on it. And they're cool with it. And you got to get out that mindset. And so particularly if you find a loved one just having some side effects out of the blue, or they seem a little more off or out of it, it can manifest in so many different ways. It could be maybe seeing more falls, maybe seeing confusion, maybe you see someone who's just always more dehydrated, maybe they brushed their teeth and their gums are bleeding. These are all little telltale signs. And so you don't want to just sweep it under the rug, but you want to have an open discussion about, hey, you got to get sensitive with your body, one, but really this is where caregivers play such a big role, because they're the ones who are usually, in the weeds. They're seeing the patient day to day, and they could see those changes. But literally in this, particularly in the senior space, any drastic change over some time is something that you want to start discussing with your doctor as a potential medication side effect. And furthermore, you gotta just ask. If you're not asking when you're going to your visits or sending messages in your EHR or my chart, whatever, you gotta ask, hey doc, I've been taking these for a while. What do you think about stopping one or two? What can we do to consider getting off of certain things? Like, what are your thoughts? And have an open discussion and just say, hey, look, I want to take the healthy road. I want to, have less side effects. And this is actually something that we're teaching caregiver advocates. We're actually launching, just so you know, and for your audience, we're launching a deprescribing accelerator. So we're going to be teaching people who are facing senior patients, who may be nursing home directors, other geriatricians, clinicians, pharmacists, whatever. We're going to teach people how to spot these signs and then know how to advocate in the moment when they have people come to them and they're like, hey, man, I can't even handle taking all 12 of these. What can we do? So we got to just make this a team effort, which I feel we kind of lack in our health system, and not just put it all on the doctor, because honestly, they're overloaded, and then the patients are overloaded because they don't even know where to turn when it comes to medications. You may talk to your pharmacist, in retail, but again, that's like a quick 2 to 3 minute convo, and you don't always have the time to sit down and get all your questions addressed.
So where can people, give us the information where people can get more information about what you're doing and also how to get involved with your organization or find more information about what you're talking about. What's your website? Give us all the social media contacts, everything you got.
Yeah, so the company is at GeriatrX. That's our handle. It's GeriatrX, like a pharmacist symbol, rx.org. And we have tons of free content online. You can follow us at Geriatric or Geriatrics Inc. on Facebook, but we are just at Geriatrics on Instagram, LinkedIn, Twitter as well. And we give tons of content, and we talk about this deprescribing accelerator. It's a new pilot. It's something that's really passionate to me, particularly with my grandmother, who was given a prescription and was over-medicated, and it caused her dementia to completely spiral out of control. And it wasn't until 4 months of suffering that a pharmacist stood up and found that she was on something that was completely harmful for her. So she's the inspiration of why I started this, and she's why I'm a geriatric pharmacist as well. So I'm giving people the tools to learn how to advocate and how to implement in real time with our deprescribing accelerator course.
That's well
and you
done.
can find all that on social media as well, on Facebook and Instagram and LinkedIn.
Okay. And one thing people don't realize also is that when you see a doctor who's maybe a general practitioner and even an internal medicine person, an internist or something like that, one thing you have to realize is that they're not always, even though they prescribe medication, they're not experts. They're not biochemists per se. They're medical doctors. They don't understand necessarily all the ins and outs, the details of every single medication that they're prescribing, as well as a pharmacist does. That's their specialty. Right. Their specialty is doing something else, seeing what your cough is about, things like that. So they might not be as well versed as some other people that specialize in prescribing medicine. So you have to ask these questions and kind of dig deep and understand like what it is that you're putting inside your body. On that note as well, there's also a huge industry in natural medicine, homeopathic therapy, and people are taking all kinds of, herbal grass, weed, mushroom stuff, ginger root, all kinds of stuff, whatever. All these things, these natural remedies that people are taking, how much of a threat, or is it a threat, that people take these things sometimes as even an alternative to a medicine? A doctor might say, I'm going to prescribe you this. But I say, well, no, I don't want to do that. I'm going to take this thing or so on this infomercial late at night that says it'll cure my HIV or whatever. Something. So, so how much of a danger, and is that a real risk? Is that a real thing?
Yes. We as pharmacists particularly are trained to identify drug interactions with herbal products, natural supplements, with other medications and food. And so we are trained to spot those things, but we're also trained to realize that there are a lot of drug interactions out there over the counter. So it's a real problem. And so this is not to poo-poo on the field of natural medicine and holistic health. I think there are tenets of it that are super important, and we need to incorporate them. The problem is, in this country especially, a lot of the products that are over the counter are not regulated by the FDA. And so even though you read a label and it says, hey, you're getting 500 milligrams of cinnamon, you may not even get that. They don't have any real reason or incentive to tell you the truth, and they don't. In fact, they have multiple studies that test them, and they have tons of products in them that aren't even legal. Like, they're actual prescription drugs in some of these natural products.
Wow.
So they're contaminant, and so it's not, again, to bash it, but you have to be cognizant of what you're taking. And then the problem I find is that because it says natural, people just think it's fake. It's like, well, it's fine. It's from the earth. It's cool. I had a patient who was taking cinnamon extract to help with, weight loss, metabolism, diabetes. But we ended up finding out that the extract she was taking was causing heartburn.
Wow.
And she was taking that cinnamon extract for 5 years. So tell me why she went to the doctor for almost 3 years with heartburn, and no one could find out why she had heartburn.
Wow.
No one knew why she was suffering. And so guess what happened? They ended up prescribing her a prescription, ranitidine. She took it twice a day. Didn't work. They ended up going up, and then they gave her pantoprazole, another stronger stomach heart acid reducer. They gave her that twice a day, like super high dosage, right? She failed that. And it wasn't until she finally came to us and said, hey, I don't know what's going on, but I've been having this issue. I was like, oh, it's this. And with one medication review, we were able to show how much money she has lost over the past 3 to 4 years from something that's completely preventable.
Wow.
And no one identified that. You know what I'm saying? So that's the importance of not everything natural is safe. And if you are buying something over the counter and you want to go that route, just make sure you talk to a health professional or pharmacist, to screen for any drug interactions and make sure that anything else you're taking doesn't conflict with it. Because guess what? A lot of over-the-counter medications do have interactions with food and prescriptions.
Right. My mom would be listening right now and saying, I'm not taking anything over the counter. All I'm doing is taking, vitamin C and D3-100 and the new thing I saw in Herbalife. They're not considering those over-the-counter medications, but those are over-the-counter drugs you're putting into your body. It's because you got it in the aisle versus over-the-counter doesn't mean over the pharmacist counter. Over-the-counter means you got it somewhere in a healthcare place, or whether it's CVS or Walgreens. All those things fall in that same category. Yeah, and that's actually one of the biggest problems I find in med reviews is that people don't talk about the herbals, the vitamins, etc. And if you don't talk about them, we're not going to know if there's an interaction. There are so many antibiotics that have interactions with vitamin supplements. Wow.
And people don't realize that. There are certain times you got to time your heartburn medication with some of those antibiotics and other meds. So that's the beauty of having your own personal pharmacist, and that's why I'm so passionate about getting people aware and then advocating for those patients and caregivers who just don't know if it's really the meds or not.
Well, Dr. Canterbury, I appreciate your time and also the work that you're doing. We got to have you on the show. We can talk for hours about a lot of stuff that we touched on. We just scratched the surface of what you're working on. Well, thank you very much for your time and wish you well.
Yeah, thank you so much, man. Enjoy your weekend.
You too. So that was our great guest, Mr. Dr. DeLon Canterbury.